Hey guys, it's Dr. Liz Chamis here again from Results Rehab, and we are going to talk a little bit more about loading the spine in a back squat and how this can be the weakest link right here in the mid-back. So in order for you to do a proper squat, you have to have this weight lined up. So Janessa, I'm going to have you go ahead and you're going to create tension up here in your thoracic cage, right around your shoulders, and right here by taking a deep breath in, and on the exhale pulling in with the belly button, and you're going to go ahead and go down into a squat. And I'm just going to show you the line right now that she has. This nice line here through her spine where the weight is stacked right up over the ankles. The weight is in the heels, and if you notice, the weight is not pressing forward. Go ahead, Janessa, and just show me the back position where you lean forward. Yep, I want the elbows to flare out, and now look up like we had in our first video where it's not a good position. Now see, she's got the bend in her neck, the weight's coming down right on her spine right here, and if she stands up, notice that her elbows are flared out so much that the spine really takes all the weight. Now go down, get in a good position for us, so create some tension here. She's gonna act like she's breaking the bar in half. She's gonna neutralize the wrist right here, so you see they're nice and flat. Her elbows are gonna come forward, and she's gonna keep this nice and neutral here. So inhale, and then on the exhale, we pull the belly button into the spine, and then we go ahead and lower in a squat. She's in a good position. And then when she stands up, the weight is almost floating off of her traps, and it's driving right through this vector right here, which would be the elbows, and then the wrist, and it's going right up through the hands. So it makes it a lot easier to lift heavier, and when you're fatigued, if you can keep this engaged right here and keep your lower back engaged, really it's your belly pull into your spine, so you protect your spine and your pelvis right through here. So now this spot in your back, when you're fatigued, it doesn't take the brunt of all that force of the weight whenever you get fatigued, so you'll have less pain in pulling right through here, and less pain in shearing through the lumbar spine or the SI joint, as some of you have possibly heard when you get hurt. So go ahead and show us a good squat with the weight on your back, Janessa. She comes down, so when she stands up, it's loaded right through here. She can stand up nicely with all the force coming right through the barbell as she stands up. Good, go ahead. Now come down one more time. Show us the back position one more time. So this is somebody who gets really fatigued, the weight's gotten heavier, maybe in the middle of your workout. The elbows are flaring, the weight's coming down right, basically on top of the knees, as you can see. She has nothing to lift the weight up except her spine right through here as she lifts up. So that would be a lot of pain right through here and right through here. And we are hoping to help you prevent that as you lift by creating some tension right through here and tension right through here. And we do that by taking a nice deep breath as you exhale, pulling belly button to spine. And I tell Janessa, act like you're going to break the bar in half, keep your wrist neutral, and elbows forward. There you go. And hopefully that will help you guys when you lift and do your back squat and load your spine correctly. Thank you.